welcome to the NewsX Sunday Guardian Roundtable. Well, this week we're going to be focusing on medical issues. We're going to be taking a look at the rising cases of strokes in young Indians. Why are the young succumbing to a disease, whether it's heart diseases or strokes, at the age of mid 40s to even sometimes early 20s? That is something we're going to be discussing. Is it because of the urban lifestyle, the stress of living, and also the rising cases of flu and influenza, the H3N1 virus? They've also been reported because of change in weather, because of the pollution. I think our respiratory health needs to be taken a look at. All these questions and preventives and what one can be done in terms of checkups and screenings, that's going to be on the table today. Joining me is Dr. Harsh Mahajan. He is the founder and chairman of Mahajan Imaging and Labs. I have Dr. Romel Tikku, he's the director internal medicine at Max, and Dr. Pradeep Quatra, he's a physician, diabetologist, and cardiologist. Dr. Mahajan, I'll begin with you because in fact, this whole thing has come up by an article I read that you had written about the rising cases of stroke. You also quoted the International Journal of Stroke, which says that there are as many as 1.8 million stroke cases in India, but out of 1 in 4 Indians only have access to stroke-ready hospitals. So these figures are alarming. What can be done?
Well, Priya, thank you for having me on your show. These are actually facts, and those of us who practice on the ground know that this is the case. Even in cities like Delhi, at times, if someone has a stroke, even determines himself or herself that this could be stroke, reaching a hospital is a big problem. As it is, heart attack somehow has entered the consciousness of society, of people at large, very clearly. Whereas what now is being called as brain attack or stroke still, is something where a lot more education, awareness needs to be created. And there's no doubt, unfortunately, that most of these non-communicable diseases, be it stroke, be it heart disease, diabetes, cancer, they tend to occur in much younger individuals in our country as compared
Yes.
to our Western counterparts, nearly about 10 years earlier. And we are seeing the consequences of that. Stroke is a very debilitating illness because it leaves you paralyzed, it leaves you, dependent on your family, on society. And that's why I think this is a move in the right direction, this program, to create awareness so that at least some preventive measures can be taken to determine whether someone is at higher risk as compared to others, and also to be able to recognize what are the early symptoms, the common symptoms of stroke.
Okay, Dr. Tikku, Dr. Mahajan, I'm going to come back to you in terms of the screening and what all can be done. But before that, Dr. Tikku, what are the symptoms and what does one look for, and what should one be careful about?
See, when it comes to stroke, we are seeing a lot of young people getting stroke. You have to look at the risk factors. Diabetes, hypertension, high cholesterol, family history of stroke, smoking, all these put you at a high risk. Now, coming to symptoms, if you have sudden imbalance while walking, drooping of jaw or face, vision changes, or slurring of speech, or weakness of one arm or leg, so you could be having stroke. So time is the key, as Dr. Mahajan rightly said. So you have to reach the hospital within 1 hour. So if you manage to do that, that's called the golden hour. If you reach the hospital within that 1 hour, things can be taken care of. There are clot busting drugs, TPA, which can be given within the first 30 minutes. Ideally, it should be given within the first 30 minutes, up to 4.5 hours. And we can prevent major disability for life, or even prevent death at times with major strokes. So if you're aware of what the symptoms are, then naturally you'll immediately be in touch with your doctors. But then the facility has to be there. So ideally there should be a hub and spoke kind of model where you see, immediately you'll go to the nearby hospital or a small center. They have to be well aware of what has to be done, because what happens most of the time is that we waste time. So immediately they have to be shifted to a tertiary hospital where you need the basic stuff. You need a neurologist, you need a CT MRI, and you need the drug. So it's not a big deal in big cities, at least. So awareness is the key, and time is the essence, and you should know what the symptoms are. If you manage to do that, you will prevent major disability.
Okay. Dr. Pradeep, if you see the symptoms, what should one do in terms of, and what is the treatment Dr. Tikku has spoken about? But is there any off-the-counter medicine that one can keep in the wallet and, have it if you feel there are some signs or symptoms that Dr. Tikku has told us about?
So be fast means balance eyes, face, speech, weakness in any part of the body, and then the time. Within 1 to 4.5 hours, that is the golden period. But in Delhi, first the awareness, as Dr. Mahajan has already explained, and second part is then the delay in getting the treatment at the right place and with the right help of the doctors.
Right.
The point which you are asking about the emergency medicine, in case of cardiac heart attack, we can ask the patient to take ecosprin or disprin. But in case of stroke, disprin is not the emergency treatment, because CT scan is very important and it has to be done to rule out stroke because of hemorrhage. If it is hemorrhage, then it is detrimental. So CT head is very important and first and foremost thing to devise treatment or plan treatment. So there is no emergency treatment except going to the hospital and getting a CT scan done to rule out whether it is a thrombotic stroke or it is an hemorrhagic stroke. So that is very important. It means ecosprin or disprin does not work in a stroke. It should not rather be used as an emergency medicine.
Okay, so in fact, self-medication is not recommended at all. So, Dr. Mahajan, you are in the business of testing and screening also. What does one do? How often should one test, and what are the tests that one should take and the screening?
See, Priya, most of the tests are very simple to determine whether you are at higher risk. Blood pressure measurement at regular intervals, which is so easy to do. One can do it oneself at home. Because, as Dr. Quatra said, if there is hemorrhagic stroke, that means bleeding in the brain. In a large majority, the reason is high blood pressure at that point of time, and then a blood vessel bursts. So, knowing your blood pressure, if it's high, keeping it in check by regular medication. And here I like to say many people will discontinue medicine. They have it for a few months and then they ab main theek ho gaya, maine band kar diya. This we have to remember, especially in essential hypertension or blood pressure which comes with age. That medication has to be for life. You may actually need to titrate the medication, increase dose, lower dose, but you cannot stop. One has to remember that it's for life. Then, second is whether someone has diabetes or not. So, simple tests like blood sugar check, because that is again a risk factor. And then keeping your blood sugar within limits. Third is lipid profile, our cholesterol levels in the blood, and also most importantly, the LDL cholesterol, which is the bad cholesterol. We have to keep that in check. One, by lifestyle modification, lifestyle modification is needed for everything. A healthy living, exercise, all of that help. But there are at times our genes which play a role in elevating the cholesterol levels, and that's where drugs need to be taken, like statins, which I've been having statins for the last 24 years. And our Punjabi blood actually, we have genes which are more prone to higher cholesterol. So keeping that, and this is where your, general physician, your internal medicine specialist, your cardiologist, your diabetes specialist will come into play to actually tell you how much of dose to have and things like that. Then, on a regular basis, one can actually do a simple ultrasound of the neck. We call it a carotid Doppler, where, in a 5-10 minute test, you can know whether there are any deposits in your blood, in the arteries, the carotid arteries, the vertebral arteries which supply blood to the brain. And if there are, then, we need to look at that. At the same time, one can also look at the coronary arteries, the arteries of the heart, which can be done using multiple techniques. But CT coronary angiography is probably the gold standard non-invasively to look at the coronary arteries, see whether there are deposits within, what kind of deposit there are. Are they fatty deposits? Are they calcified deposits? Fatty deposits are more dangerous because they can break and cause a heart attack. So at the same time, please remember that all arteries in our body more or less follow a uniform kind of pattern. So if in your neck you find that there is narrowing because of plaque formation, we need to check our coronary arteries of the heart. So essentially, if some of these simple things are taken care of, then we can go to the CT angio or the neck Doppler. And then the earlier that we check blood pressure, cholesterol, diabetes, even in the young, even in school-going children, we can pick out those who are at increased risk because of genetics. And these are very simple tests, can be done in the school. And then you follow up those where you find blood pressure was high, or that even children can have type 1 diabetes. Even children can have raised cholesterol. So, of course, the tests will vary based on what your age is. At 30, it'll be something. At 40, 50, 60, it may be different. Also, your family history of heart disease, your own personal history of what is the problem you've had. You are now 60 years of age. What was the problems that you've had in those 60 years? They determine. So today we talk about personalized health checks. Of course, there'll be a certain minimum test, whether blood tests or ultrasound or X-ray or CT, which will be common. But then based on your risk profile, there may be more things that need to be done.
Okay. Dr. Tikku, thank you. That was very comprehensive. But Dr. Tikku, some of the symptoms Dr. Mahajan spoken about, whether high cholesterol or, in terms of stress, tension, these are all usually middle age crisis, as he said. But now we're saying young people are also having it. Are you seeing more cases of the young coming in with this?
See, we used to consider stroke and heart attacks diseases of the old people, but it's
Right.
no more like that. We see a lot of young people coming with myocardial infarction, stroke, heart attacks, and there are multiple reasons for that. It's lifestyle, it's environment, it's food habits, lack of physical activity, too much of stress, job stress, relationship issues, work pressure, and faulty eating habits, eating too much of junk, eating too much of sugar, and processed packaged food, smoking, vaping, too much of alcohol, binge alcohol. And these are all issues which basically contribute to diabetes, hypertension, and eventually heart disease and stroke. Obesity, I mean, it's become an epidemic. So most of the obese people usually tend to have diabetes. They usually tend to have high cholesterol, hypertension, and they are the highest risk of a stroke or a myocardial infarction, which is heart attack. So then, apart from that, the fact that people are not aware of the health checks that they should be doing, which Dr. Mahajan spoke about. A basic blood pressure, cholesterol, sugar, this has to be done at least once a year in 30 and above with risk. It's not about age, actually. It's about the risk factors. Whether you have all these risk factors, whether you're a smoker, whether there's a family history of heart attack or stroke. And we've also seen pollution. Now in Delhi, pollution can trigger heart attacks. It can trigger strokes. Apart from the respiratory issues that pollution does. And we've also seen post-COVID, a lot of young people, because of a pro-inflammatory state which COVID caused, and people who had bad COVID usually have other issues. And the ones who had a bad COVID usually have these issues of stroke and heart attacks. Not every other person, but we've seen that post-COVID, these episodes have been rising, especially in the young. And genetically also, we South Asians are predisposed. We get atherosclerosis early than the others. So there are a host of factors which leads to this. So the key is basically being aware, doing a health check, and maintaining a good lifestyle. Physical activity is very important. Eating the right food, yoga, de-stress, detox, give time to yourself, spend time with your family, get into your hobbies, whether listening to music, going for short vacations every three, it just recharges you. So that's the key, I would say.
I think you need to come and have a word with our boss, Dr. Tikku. This 3 months vacation to nahi hoga. But before we go in for a break, Dr. Pradeep, in terms of diabetic patients, what are the do's and don'ts that you would advise, not just for stroke, but the precautions that someone who's diagnosed with diabetes should be taking?
For diabetes specifically, first of all, is the weight. Weight management is hallmark of diabetes management, because with weight loss, insulin resistance improves, the response to medicine improve, and diabetes control comes into picture. Because if you are not aware of your weight and you are not conscious about your weight, sugar control goes haywire. So first and foremost is the weight, and then the compliance with the medication. Because as Dr. Mahajan said, in Indian context, you see patients, they come to us, they say sugars are under control, so they leave medicine or decrease medicine of their own without consulting doctors. So that is another point. Compliance is again very important. And then the right medication, like Dr. Mahajan said, use of statins is again very important in diabetic patients. And this has been recommended universally. Male after 40 and females after 50. Those who are diabetic, statin should be given, but whatever the lipid profile is. So that means we can add LDL cholesterol is again very important. For diabetics, that target is very low. And but in our labs, the old readings are coming. So people say, as per lab reports, our cholesterol is normal. But being a diabetic and the latest guidelines, the LDL cholesterol has to be lower, and lower the better for diabetics and for coronary artery patients. So again, use of statin is very important. And in Indian context, patients, they don't like taking statins. They have the notion that muscle pain will come, the other problems will come. But these are all myths, and statin use should be encouraged in diabetics, and they should take it. So, and also now we have, we can stratify, or we can, with all the risk factors, we can tell the patient the risk factor. If you have diabetes, hypertension, smoking, alcohol intake, with lipid this, then we can say the risk, we can have markers. We can say 10 years risk is how much, and for a particular patient, and then we can increase or decrease. And statins play a very important role in all these thrombotic events.
Okay. In fact, I'm glad, Dr. Mahajan, you mentioned that you take statins, because there is a taboo around statins. As you know, we hear everybody usually advises mat lo. But I'm going to take a break and come back and keep the conversation going. So stay with us. Hello and welcome back to the NewsX Sunday Guardian Roundtable. Well, this week we're doing a medical bulletin of sorts. I have with me Dr. Mahajan. One more question I want to ask you is the use of AI in testing, in terms of whether it is detecting stroke, likely stroke patients. You talked about children, that there could be some markers, so we should begin testing young. So is that also now being employed?
Well, in imaging, because imaging and radiology tests have been digital from 3-4 decades, so it was this was the one specialization where AI started being made and tested right from 2015, 16. In fact, we've been involved at Mahajan Imaging in Labs with AI since 2016, making our own algorithms, then making a platform. But without going into details of that, today AI algorithms are being developed where they are helping the radiologist very quickly to make a diagnosis. So what happens? A scan is done, a chest X-ray, a head CT, a head MRI. It's fed into the computer, and there, with the AI that's inside the computer, it comes back with a result. In fact, there are algorithms which also give you a diagnosis, a report. And with that, actually, in the emergency setting, like we said, time is brain and every minute matters. So quickly you can get that report that is vetted by the radiologist and then action is taken.
Okay.
Dr. Quatra had mentioned that it's important to first do a CT scan in stroke. Simple, non-contrast CT scan, which takes a few seconds to do, where we can rule out whether there's any brain hemorrhage or not. That's the idea. Once brain hemorrhage is ruled out, then we can follow all the instructions that Dr. Iku was telling about giving TPA or other blood thinners so that we can actually reverse the effect of stroke. And AI here, there are multiple algorithms available across the world where it is in day-to-day clinical use. Now think of a scenario, and again, Dr. Tikku talked about the hub and spoke model. In a large institution which has a specific stroke unit, there is expertise available to make diagnosis, do treatment, but these will be in large cities, whereas stroke happens everywhere. So in a tier 2, tier 3 a town, what does one do? That's where AI is playing a role, that peripherally it makes the diagnosis and then sends that the images and the report that the AI has generated, because there's no radiologist available there at that time, sends to the neurologist, who will then decide that can it be treated at that peripheral level, that this is what injection you give, and then you may or may not come to the stroke center, or that you have to rush to the stroke center. These AI is helping neurologists, helping neuroradiologists in this decision making. And ultimately, what we believe, that AI will actually be able to take some of the mundane tasks of the radiologist, like measurements, how much is the volume of a tumor or a hemorrhage, and also be able to point out the abnormalities on a CT, X-ray, or MRI, so that the radiologist spends much lesser time in reaching a conclusion. So two things will happen with that. Your turnaround time of reports improves. It's not hours, it could be minutes, especially in emergency situation. Two, it's able to flag critical findings that you cannot delay. There's brain hemorrhage. Go ahead and do
Okay.
something about it. Three, it'll increase the productivity of a radiologist. Today, if I'm able to write 25 reports in or 30 reports in 8 hours, we envisage a scenario where we may be able to do 100, 200, 250 reports. That's something which happened in blood testing and pathology. And today, a pathologist signs off hundreds of reports and no one
Okay.
questions their veracity. So, AI, still in its infancy, but coming in a big way. And I see this playing a major, major role 5 years down the line. And I do believe, for radiologists and for doctors, doctors with AI will actually replace doctors who don't use AI in the coming years. And it's not that AI will replace doctors as a whole, because doctors will still continue to play a role. That pat hand on the shoulder, the spoken word, those still matter.
Yes, lived experience definitely does matter. Dr. Tikku, do you want to add to the use of AI? And I also want to ask you about we are having this conversation in the onset of winter. The rise of pollution, what impact that is having. We are seeing the rise in the number of cases of flu, for instance, viral or whatever.
Yeah, we've seen a lot of flu cases in September and early October,
Oh, that's
stage
right.
3 and 2. Yeah, but the cases were waning. But because of the temperature drop and sudden spike in the pollution, we're seeing more and more flu cases again in the OPDs. And it's not only flu, it's also the pollution. Choking, chest issues, wheezing, cough, burning eyes, watery eyes, sinusitis, exacerbation of bronchitis, COPD. A lot of patients who have lung issues, cardiac patients, diabetic patients are having a lot of trouble right now in Delhi. Actually, it's a public health emergency in Delhi, but things have to move on. We are used to it, so it's a new normal for us. But otherwise, for children, for elderly, for pregnant women, it's a major, major health risk. So I'm expecting that this will get better in the next couple of weeks, but as of now, it's pretty bad. So, a lot of admissions happening with lung issues, a lot of people coming to OPDs. And even because the temperature suddenly has dipped, there is too much of viral infection also. Then this is going to increase in winter. This is the season. So one has to be careful. Again, don't go out when the pollution levels are at their peak, early morning, late evening. You should avoid going out. Even if you have to go out, wear a mask. At home, you should have air purifiers as much as you can do, but you still have to step out. But the elderly, the ones with chronic medical issues, they should have their vaccinations done. The flu vaccine, I would again stress on flu vaccine. The winter has already set in, so you need a flu vaccine. Elderly and the ones with comorbidities need a pneumonia shot also. There's one new one shot which has come up, the vaccine for pneumonia for life. You don't have to take every year. You don't have to take every 5 years. And the precaution prevention is the key, I would say. Otherwise, this, again, long-term exposure to this kind of pollution is going to have its health hazards later on in life. With lungs, it can lead to lung cancer, COPD with heart. Again, the vasoconstriction, the narrowing of vessels increases, the pollution increases the heart, the blood pressure, the heart rate. It can lead to stroke. It can lead to heart attacks. So it's a double whammy, I would say, especially in Delhi. The pollution, the winter, the viral infections, everything together. So one has to be very careful. Take your inhalers, take your nebulizers on time. Too much of fluctuation of blood pressure and sugar happens in winter. So you tend to have cravings for sweets and fried stuff. So you have to control yourself, keep a tab on your sugar, blood pressure. Checking blood pressure is simple. Keep a tab on it.
Okay.
And coming back to AI, so Dr. Mahajan has told you it's used more in radiology as of now, but it does help all other doctors as well. The CT scans, the MRIs, they differentiate between hemorrhagic, ischemic stroke, pick up very minute lesions. Even in chest, the lungs, you can pick up those small nodules, calcified lesions and stuff like that, tuberculosis and cancers, even for breast mammography or whatever, where you don't pick up lesions, breast cancer. AI can help you. So it has a long way to go, but it's the future, as Dr. Mahajan rightly said. And then AI is also used in, say, smart watch and stuff like that. You have your ECG in your watch, you have your heart rate, you have your sleep pattern, and even when now they're saying with sleep apnea, you can check on your watch whether you have apneic spells during your sleep. So yeah, it is the future, I would say.
Okay. Dr. Gatra, last word to you, in terms of the use of AI in, medical diagnosis and treatment, and also in terms of, if you want to talk about the rising cases of pollution and any other thing that you want to add to what Dr. Tikku has said.
So AI is definitely there to help us, and especially in diagnosing different problems and also in stratifying the disease problem. AI is going to be there and it will be a big help to the clinician also. But at the same time, clinical sense has to prevail and clinical science or your clinical judgment should be there. And regarding pollution, we all know pollution is creating problems in Delhi, and whosoever comes with chest problems, spasm is there, as Dr. Tikku has already explained. We have to give inhalers, nebulizers. And at the same time, we have to understand this PM 2.5. It does not only, it not only affects the lungs, it goes into the blood circulation also, and it creates an inflammatory process, oxidative stress, which leads to atherosclerosis and the other problems, leading to fluctuation in the blood pressure, fluctuation in the blood sugar, and all chronic ailments are related to pollution. And long exposure to pollution creates all these problems. And today's headlines, 15% more deaths because of pollution in Delhi. So that is again playing a big role in our day-to-day life.
Thank you so much for this conversation, all of you. I think we've given our viewers a lot to think about, and hopefully the testing and following the doctor's orders is a must. That is really what has come through. But thank you for this conversation, and stay safe and happy. Wish you a happy winter season. Thank you.
Thank you
very much.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.